epinephrine, Claritin, things like that. Then you have the trade name, then you have like the actual brand, right? So, sorry, generic brand of Claritin would be Loridine or something like that. I know it's LOR. I'm not super great with drugs, as you can tell.
Loratadine.
Huh?
Loratadine.
Loratadine, see? I think I was close. Loratadine. So the trade name, though, would be Claritin, right? That's like a brand name. So know those three things. Physician's desk reference is commonly called PDR. You don't see these very often laying around radiology because, like I said, we don't use drugs very often. Nurses, however, have these everywhere. It's an annual publication and it has to be updated because drugs change all the time. It's available online, but it gives accepted uses, side effects, contraindications, biochemical actions, drug class, and dosage as prescribed by the FDA that are approved. If you can't look it up in a physician's desk reference, you need to ask a pharmacist. Any of you in here ever think about going into pharmacy? Ooh, one.
Well, it was only because a good friend of mine, Nicole, also took pharmacology, and she's a pharmacist, so
Yeah.
she likes it. But
It's a lot of chemistry.
she's also, I don't like chemistry, so I was like, I'm out.
Yep. That's a hard line right there, right?
Yep.
So, drug classification and dosage classification by chemical action. So you're going to lump them into drug families, and then classification by legal name. So if it's prescription or over the counter, so prescription versus non-prescription. And then you have your dosage forms. They can come in a couple different ways. Most common is tablets. A lot of us take tablets, inhalants, suppositories, capsules, solutions. You give more solutions to little kiddos, right? Or suspensions. You can also have transdermal patches nowadays, and creams and ointments. There's even, I would add to this, injectables. I take an injectable every month for my migraine meds. So some classification as far as drug action, you have, bless you, analgesics, anesthetics, anti-anemic agents, anti-anxiety, anti-arrhythmics, antibiotics, and sorry, I'm going to butcher this, antiolingrics, sorry, anticoagulants and antidepressants, just to name a few. Then you have anti-diabetic agents, anti-emetics, antifungal, antihistamines, anti-hyperlipidemics, antihypertensives, anti-hyperparkinson agents, antiplatelets, antipsychotics.
Oh my God.
A lot of antis, right?
Jeez.
Anti-ulcer agents, antiviral, benzodiazepine antagonist. Say that 10 times fast. Bronchodilators, which is what your inhalers are. Inhibitors. Huh?
I said it not right.
Yeah.
Sounds like
Coagulants, corticosteroids, diuretics, and hormones. Some of these you guys take every day and you don't even realize it. Anti-Alzheimer's, mood stabilizer drugs, NSAIDs, which is non-steroidal anti-inflammatory drugs, opioid antagonists, osteoporosis drugs, sedatives, stimulants, and thrombolytics. So, how pharmacology works is the kinesiology within your bodies, whether they're absorbed, distribution, metabolized, or through excretion. Absorption is the movement of the drug from its site of administration into the blood. Distribution is the movement of a drug from the blood to the various tissues or organs. And the metabolism is the chemical alteration of a drug, principally by the liver to the permanent excretion. And then excretion is the drug movement out of the body, so your kidneys are flushing that. Controlled drug schedules, this is regulated by the Federal Controlled Substance Act. Some of you might know someone that is on controlled substances. There's a lot of regulations on these, rules. You can't pick up their meds unless you're on a list. A lot of times you gotta show ID for these. A lot of times they do this because these drugs show a likelihood of abuse or physical or physiological dependency. Oxycodone being one of those. If you guys haven't seen any of the documentaries on oxycodone and how that came to be, I highly, highly recommend. There's a good book out about it too. If that interests you. Anybody know anyone that's been hooked on oxy? Yeah, it's pretty sad, right? It's like basically giving you heroin in a pill form. Right? We only would have known.
Yeah. Oh, they knew they would be screwy about it. They knew.
Oh, for sure. For sure. Well, and then they were lining the pockets of certain doctors to push it, right? So, you need to really understand how the kinetics work under these 4 categories. Let's talk about drug distribution through absorption of the drug in the body, and then how it goes through the circulatory system. It has a couple different factors that may affect it: adequate blood flow, drugs, affinity for lipid or aqueous tissue, blood infections or abscess, drug-to-drug combinations. How does it get into the circulatory system? A lot of times it's just through when it's absorbed into your stomach and then out into the circulatory system. It could be injected, it could be a pill form, right? Bioavailability is the amount of drug that reaches the systemic circulation. That is a key term. Drugs must be absorbed in order to begin activity. Absorption of the drug into the body and its travel to the intended site of activity via circulatory system. And again, those factors, you have adequate blood flow, drugs affinity for lipid or aqueous tissue. Yeah.
What does affinity mean?
Affinity. Oh.
Like drugs affinity, like I don't know what that means.
Like it's attracted to.
Like water and stuff?
Mm-hmm,
Okay.
because aqueous means water.
Yeah.
Yeah.
Okay.
Sorry, I wasn't seeing the word affinity on the slide, and I was like, what? But I just said it. Blood infections or abscess and drug-to-drug combinations. You don't want drug interactions to be bad, right? So that's why physicians need to know what you're on and what they're potentially going to give you. It's very important. When we're talking about drug metabolism or biotransformation, the metabolism of the drug by altering its chemical structure. It occurs through 4 major pathways. You have oxidation, reduction or addition of hydrogen, hydrolysis, and conjugation. Sorry. Conjugation. That is a tongue twister, sorry. Metabolism is affected by many factors: your age, how healthy you are. Sometimes people's metabolism is super great in the morning versus later in the day. Genetics, if you've got a disease process going on, it may affect your metabolism. And other drugs in your system may affect your metabolism. How many in here have done a small bowel follow-through yet? Did they ask if the patient's on any pain meds?
Mm-hmm.
Were they on pain meds?
I don't think so.
Okay. Why do you think they asked about the pain meds? Because most narcotics will slow down your peristalsis in your gut,
Oh.
okay? A lot of people that are on heavy doses of oxy and other narcotics like oxy, it actually slows down that peristalsis and they tend to be chronically constipated. So, yeah. So a lot of times what they'll have them do is hold the pain meds, at least for a little bit, during the small bowel follow-through, because that's all you're testing is the peristalsis of the small bowel once you put the barium in, right?
Yeah.
So a lot of times they'll want you to hold that, because if the patient can't get through the study without the pain meds, it's not going to be an accurate portrayal of what's going on with their peristalsis and their small intestines.
Yeah.
Okay. So a lot of times that's why they'll ask. So that's just an example of how drugs can affect your metabolism. Because we're doing this at 8:30 on a Monday. Okay, so drug interaction is the behavior of a drug in relationship to other drugs in your body system. And yes, they classify barium as a drug. You have to actually chart it now by rules and regulations. Iodine is a drug. Even little saline is a drug, okay? Removal of the drug from the body or excretion it's performed by the kidneys, but things help it along the way, like the liver and the biliary tract, your lungs. You can sweat things out. Your saliva, it can actually come out through breast milk as well. So those are all forms of excreting the drug.
Just hit on the window.
I can't get mad at him. He looks like my frickin' nephew, and he looks like he's maybe like 10 years old. So he probably has no clue. Factors that influence drug action, again, age, how healthy you are, the time of day, emotional state, because if sometimes, believe it or not, if you're anxious or depressed, you actually don't metabolize things well. Your body kind of is affected by that parasympathetic nervous system. Those other drugs in your body can affect how the drug action is in your body. Genetics, there is a genetic component that can affect how your body metabolizes the drug. My mother-in-law, may she rest in peace, Benadryl was not a downer for her. It was a super upper. She would be wired. You laugh, but she, poor thing, had Alzheimer's for a long time. And they tried that one day to get her to like calm down, go to sleep, and it did the exact opposite, and they never did it again. Well, I tried that with my children, and guess what? They metabolize it just like their grandmother, and it does not work as a downer for them. It does not make them sleepy, it just amps them right up. So there is sometimes a genetic component. And then if you've got a disease process going on already in your body, this can interact with how a drug might be absorbed or works on your body. Side effects, it's the result of a drug acting on tissue other than the tissues intended, causing a response unrelated to the intended action. This can be idiosyncratic or anaphylactic. Idiosyncratic is the drug reaction does not occur in most patients who have been treated with the drug and does not include the therapeutic effect of the drug. Anaphylaxis is a severe drug reaction bringing with respiratory and cardiovascular collapse. Anybody in here have to carry an EpiPen besides me? No? Good to know. And we still don't know why I had the reaction that I had. I was on an antibiotic, but I've had antibiotics off and on my whole entire life. I was being treated for what they thought was a sinus infection, and my body just went haywire. And so we're still not really 100% sure what it was. I just don't take that antibiotic now or anything like it, but it was definitely weird and scary when your face starts swelling and you can't breathe. Sedation drugs You have minimal sedation, moderate sedation, and then deep sedation, which is analgesia, and then you have general anesthetic. Minimal sedation, and anxiolysis, sorry, I don't know that word very well, obviously. Conscious sedation, you'll see conscious sedation a lot in procedures. You'll have a patient ask you for conscious sedation or just sedation for a lumbar puncture or a myelogram, and you really shouldn't do that. Sometimes if it's a critical patient and they're not holding still, but they need to for a procedure like a lumbar puncture or a myelogram. Any of you seen that yet? No? A myelogram?
I see like 2 days.
They put a needle in their back. Yeah, so they put a needle in their back, they put contrast in. Some people don't do well with needles, I get it, I have 2 of those at home as well, that freak out. And they want mild sedation, but we really need their cooperation. A lot of times you have to move them around the table, you might have to tip them head up or head down to get the contrast to go in the spine where you need it. But if the patient is really having a hard time holding still, we might give them a mild sedation. It has to be monitored when you do moderate sedation. A lot of times you have to have a nurse present, you have to have them on monitors, because some people, when you start to sedate them and give them heavier drugs for sedation, their blood pressure and their heart rate go. A lot of times they need to have oxygen on as well, because they're not breathing as well. And then deep sedation, a lot of times they do that in interventional radiology, or like minimally invasive surgeries where the patient isn't completely out on general anesthetic, but they're mildly sedated. They do this a lot in the heart cath lab. So if they're going up and putting a stent in or checking for patency of the heart vasculature, a lot of times they'll just mildly sedate you, where you don't remember a lot of it, but you're awake and you can kind of hear things. My dad had a heart cath done, and they did the deep sedation, and you could tell he was not completely out because he was kind of rolling around on the little skinny cath lab table, because we could see him through the control room. Thank God there were other people around him. But it was interesting to know that they didn't completely knock him out for that, in case that there was something more severe that they needed him awake for. So know how you can check your references for drug interactions. You need to know some of the categories for this. Know how your drugs are moved throughout the body, the kinesiology of the drug in the body, and those 4 categories like excretion, metabolism. Know the routes of drugs, how we would administer them, whether it's a suspension. Give me an example of a suspension that you would give a patient in radiology. Some of you may have already done
What?
it. I know Emily and April already did it.
Oh,
Give us a hint.
for a small bowel? The contrast? and stuff?
Yeah. So was your contrasted powder?
We used a water soluble through a NG tube.
Okay.
Yeah, it was rough.
So that was a liquid,
Yeah.
right? So you used gastrographin
Yeah.
probably?
Mm-hmm.
Did you use barium?
Barium or omni-P.
Okay. Did you have to add water, or was it already liquid?
No, it was already.
So she gave a suspension because it was already liquefied, but the drug there was barium and the drug for you was gastrographin, okay? And then you probably needed to dilute the gastrographin a little bit with water. Did you put water with it?
Just at the end.
Okay.
Did it like a little bit to flush it.
To flush it?
Yeah.
Ooh, that's a brutal test.
Yeah.
So that's already examples of how you guys give drugs in radiology, okay? Barium, gastrographin, iodine, Omnipeg, is I think what CT uses, and how you administer it, right? So you administer it through an NG tube, they just drink it, correct? Okay. common used drugs. Another big one you guys may or may not, interact with is, in the case of like a myelogram, did they have to ask them if they were on blood thinners? Okay, so most doctors won't do it if they've got, a low blood clotting factor, so they're on blood thinners. A lot of times they'll do a test for PT and INR, that's a clotting factor in your blood, and if it's too low, they won't do the test, because that means that little tiny needle stick that they make into your subdural space in your spinal canal won't heal up, and then it can start to leak out. Your CSF is a closed system, right? And when that change in pressure out of the CSF system kind of starts leaking out through that little needle stick, you get what's called a cerebral spinal headache. It's very, very painful. And so a lot of times that's another thing, knowing drugs, like if they're on a lot of aspirin, if they're on a blood thinner, you may have to ask and know, okay? So that's just a small example of how you might have to know some basic drugs and ask your patient in their history. And just understand that there's numerous factors that affect a patient's response to drugs. Like I said, barium is a drug. I've only had one patient in 16 years ever have an allergic reaction to barium, and we're still not 100% sure if it was the barium or if it was stress related, but she did start to have hives, and we did have to get her to the ER. She didn't have any kind of anaphylaxis as far as like trouble breathing or swelling of her airway, but she did have a hives reaction, which is a mild reaction to a drug, right? And then after administration, relevant information should be recorded in the patient's chart if you have to give them a drug. Any of those contrast studies that you guys already did, you should have, or your tech probably put it in the patient's chart. And then numerous factors affect the patient's response. I already said that, sorry. All right. That is pharmacology in a nutshell. Whole 23 slides. All right, take a quick break because we got another chapter to do.